Thank you for signing up to the MiNT UK 2023 conference. My name is Lizzie Williams. I'm a neurological physiotherapist, device lead, and a member of the MiNT Academy development team. To get us started, I'm going to give a little background on Hobbs Rehabilitation and MiNT. Hobbs Rehabilitation is primarily a clinical service provider, founded in 2004 by Helen Hobbs and Nikki Ellis, both neurological physiotherapists. Hobbs provides specialist neurological rehabilitation services in the south of England. We have 11 centres with over 100 specialist clinicians and a full interdisciplinary team. Each Hobbs centre is unique and we offer a variety of different services. These range from residential or outpatient high-intensity therapy packages to community home-based therapies. This includes a mixture of hands-on therapy as well as the use of cutting-edge technology. Hobbs provides specialist clinical services for both adults and children. We work with the NHS with a range of different contracts as well as spot purchases from several integrated care boards. We also see patients funded by the medico-legal system, case managers, insurance markets and charitable organisations, as well as a large number of self-paying individuals. Hobbs' reputation for clinical excellence means we're not only part of an extensive UK network of therapists, but also linked to a wider global network of other specialist clinicians. As well as our own in-house training, Hobbs also run national clinical training programmes and conferences. In addition to these, Hobbs staff are regularly invited to be guest speakers at national and international conferences. These training programmes importantly include hands-on clinical training as well as the clinical application of neurotechnology. We also contribute to education at both pre- and postgraduate level at several universities alongside hosting numerous student placements. Hobbs' clinical expertise and extensive experience has resulted in invitations to be clinical research partners with a range of different academic partners and universities across the UK. For example, Loughborough, UCL, Bristol, Bath, Southampton, Portsmouth and Winchester, to name a few, as well as several partners within Europe. We also feel passionately about the importance of involving clinicians in product design and development, and the key role treating clinicians should play in current research. Over the years, Hobbs clinicians have been using a range of technologies within clinical practice, some on a try before you buy basis and some we've invested in. We've tried many different devices from many different companies. Companies have had the opportunity to access clinical expertise and patient feedback through Hobbs clinicians. We trialled devices, provided valuable feedback on product design, patient interface and usability, donning and doffing, and importantly, clinical usefulness and relevance. Ultimately, this process facilitates the development of a better aligned, end-user friendly design and results in a commercially more successful product. At Hobbs, we are committed to offering both patients and therapists the opportunity to access the latest rehabilitation technology in order to improve the rehabilitation experiences, increase the intensity of therapeutic intervention, and to improve patient outcomes. But this has not been as easy as we had anticipated. We identified several challenges on our journey to where we are today. Despite our commitment, we encountered barriers and had difficulty embedding the use of the devices into our clinical practice. We identified the need for a more structured training to consolidate learning and to ensure that the clinical application was based upon clinical reasoning. The ever-growing market posed another challenge. Not only were more different devices being developed, but also a range of similar devices with a general lack of data on which device works best for who and when. We also found that there was a sharp increase in engagement requests from developers and commercial companies. This was taking time out of our clinical services, and we recognised that we needed to formalise the end-user engagement process. By doing so, we would still be able to influence the end product design, but not at our company's expense. This led us to the development of MiNT. MiNT stands for Masterclass in Neurotechnology and provides an innovative platform to encourage clinicians to embed neurotechnology into their clinical practice, and through which product developers can collaborate with us at the design stage so as to produce clinically relevant products. There were several guiding principles behind the approach at the concept stage, all of which still hold true to the MiNT ethos today. We understand that learning to use advanced technology effectively cannot be done by reading a user manual. We need appropriate and therapeutic interfacing of the patient and device that may not have been considered in other than a superficial way by the developers. We acknowledge that there is a risk of thinking that advanced technologies are cleverer than they are. Clinical reasoning needs to be applied as rigorously as we do with one-to-one hands-on therapy, We cannot use a plug-and-play approach. With a patient at the centre, MiNT uses the combined knowledge of the clinical device specialist, treating therapist and a clinical reasoning framework to interface patients with the advanced technologies and then explore optimal therapeutic application. This includes using an interdisciplinary approach with physiotherapists, occupational therapists and speech and language therapists, all part of the core MiNT development and delivery team. In 2022, MiNT was formally launched with the new website for our global community of neurotechnology enthusiasts. The MiNT Academy unites researchers, clinicians, engineers, technology experts and patients who use the devices as part of their rehabilitation. It is a holistic, structured approach to identifying and overcoming the complex systemic problems which limit and restrict the implementation and application of advanced technology into clinical practice. The MiNT Academy is now an online educational platform. Here clinicians can become members of a growing network of neurotechnology users and specialists and begin their learning journey. MiNT clinical consultancy packages for industry product research and development can also be accessed via this site to bring clinicians and patients to the table from a design to clinical application. The online community is free to join if you are not yet part of our network. The MiNT Academy provides clinical education to increase therapist skills, knowledge and confidence in accessing and applying technology to clinical practice. HOBS has designed and developed a clinical training program for therapists that provides a framework that can be applied across the range of technology products available. This process allows clinicians to embed neurotechnology into clinical practice based on sound clinical reasoning, and by doing so, they are able to address the individual patient impairments and improve functional outcomes. MiNT Education provides training across 5 levels so that clinicians can match their learning journey to their own pace of clinical development. Training will eventually cover numerous clinical devices, including logistical support for financing and implementation. Level 1 is available now free of charge and explores an overview of neurotechnology theory, including dosage, neuroplasticity, and different types of neurotechnology. Levels 2 to 5 then become device-specific, starting with e-learning, progressing to practical study days, and then on to more advanced clinical device specialist and device trainer courses. Following the launch of the online MiNT Academy, our team went on to present as a guest society at Rehab Week 2022 in Rotterdam. We delivered 5 different presentations and a workshop focused on the clinical benefits of engaging with technology development and application. MiNT was well received by clinicians, engineers and technology companies, leading to calls for a UK-based conference, and here we are today at MiNT UK 2023. Another line of education is the work we do with a growing network of universities. We have delivered undergraduate teaching on neurotechnology at multiple universities and are building links with not only healthcare departments but also engineering and robotics labs. This has provided us with the opportunity to be involved in large-scale network applications for clinical research and are research partners on a number of upcoming projects. This brings me on to the next component of MiNT, industry collaboration. So as mentioned earlier, HOBS has worked with companies for many years now, trialling their products, providing feedback and working collaboratively to improve and develop them. This collaboration ensures that innovative devices from engineers are clinically relevant, otherwise products are developed that are useless in clinical practice and therefore not commercially successful. HOBS also prides itself on being impartial and not simply working with one company and their devices. This impartiality also fosters greater respect in the findings of research trials conducted by us. In order to maintain this equity of service, especially as requests for the involvement is increased, we have developed a structure for companies to collaborate with us. Companies tend to approach via email, or there have been some connections made recently via networking at different conferences and events. Following an initial email discussion, the process we follow is: Step 1. A free introductory video call. This allows us to learn more about the product and determine how MiNT can best help, whilst the company will also receive some initial feedback. Step 2 is an in-person, half or full day clinical consultancy session with 4 specialist clinicians where the company can demonstrate their device and will receive some expert clinical feedback. They also benefit from the extensive experience of our interdisciplinary team, receiving their advanced clinical reasoning skills and insights into the management of a range of complex needs. This knowledge has been generated from numerous years working at the cutting edge of neurotechnology and rehabilitation. Our guidance during this session enables companies to further develop their product in line with clinical requirements. For the full day sessions, we can also include patient demonstrations and trials. Step 3 is a clinical consultancy package. These annual licenses provide different levels of packages and activity depending on the company's needs and requirements. These allow us to perform bespoke collaborations and undertake product research and development which is specifically targeted to the company requirements. More information about the industry collaboration can be found on the industry section of the MiNT Academy website. These are by no means all of them, but this is an overview of some of the companies who have so far inquired or are already working with MiNT. We are really excited by this interest, and it shows how greatly the concept is needed. It is good to note that the companies shown here are also from many different countries. For example, whilst Neurovert and Lakevoss are UK based, Able is Spanish, Onward Swiss, and Cyberdyne Japanese. This again shows how MiNT is also an international concept with wide-reaching potential. They also cover a wide variety of tech. Beautiful Voice is speech and language therapy software, and we will hear from them as part of our conference. Fezia is FES, Evolve is virtual rehab, and Able is an exoskeleton. Our company collaborations continue to grow and grow throughout this year, and MiNT is proving to be a much needed innovation. To summarise, the vision of MiNT was always to bridge the gap between the device, the patient, and the clinician. For patients, the benefits of this are enhanced outcomes via neuroplasticity being more effectively driven by responsive and intensive rehabilitation. For clinicians, MiNT empowers them to increase their clinical knowledge, skills, and clinical reasoning so that they can implement technology into their practice and form networks with other clinicians working to progress in the field. And for the device, we want to continue to clinically influence design to ensure useful devices are embedded into practice whilst gathering more data and evidence for service development models and academic research. I really hope that you've enjoyed listening today about MiNT, and as well as becoming a member via the website, we would also love it if you joined us on our socials so that we can continue developing the world of neuro rehab and neurotechnology together.